Hi, this is Cheryl from the ICU, and I'm going to show you how we use a Eurojet that we're going to start using standardly for all our male insertions for the Foley and females also. The Eurojet is actually 2% lidocaine, comes in a 20 ml or a 10 ml. One of the biggest problems with an insertion of Foley of a gentleman is we do not use enough lidocaine or jelly. So this is a larger dose, so we can make sure that the whole urethral tract is all lubricated for easy insertion. Should reduce the amount of coude catheters you need because of this making it easier, less spasms with urethra, and also trauma to the prostrate. So the first thing is this is all sterile. I have my sterile field already opened, just like you would do on any other sterile field. Is I will open this and put it right on top. Okay, so we're going to put our sterile gloves on first, maintaining our sterile field where we have the Eurojet. Take our Eurojet, pop off one cap, pop off the other cap, and it just twists on, and you can tell when you're done. This cap, as you can see, it's pointed. It looks like how do I say, a dull needle that would go right directly into the urethra. I like to make sure that the hub is completely full into my Foley tray, so that way I can also dip my catheter directly into the lidocaine. I will open up my betadine swabs. Just like when you normally insert a Foley, you have a clean hand and a dirty hand. So what I'm going to do is I'm going to grasp the penis firmly, point them up. I like to take one swab and wipe the tip of the penis. Then you take your Eurojet and you put it directly inside the penis. Instruct your patient that he may feel some pressure, but this will also numb the area so that way he doesn't feel it when we're actually inserting it. I will insert slowly, so that way at least half of it goes in. You will start to see at times the reflux and have some of the lidocaine back. I will close the tip of the penis. I will continue to wash the rest of the meatus and clean it. It may leak out some, not to worry, that's okay. The biggest thing is to take the time, because it takes 1 to 3 minutes for it actually to numb. And I may close it again. And then at the end, I may take what is left of my syringe. Usually I'll have about 2 cc's. I will again insert it, and this time you're going to feel no resistance from the patient at all. And insert it as much as you can the rest of the way, so all the lubrication is empty from this whole vial. So we're going to dip it in that lidocaine that I put in the tray, and of course I don't have any in here because we don't want to waste it. And then I will insert it inside the patient. And at this time you're going to see that it's going to have lots and lots of lubrication. If you have a prostrate, a lot of times if you just take the time to slowly insert, it will go smooth and slick. If you come to the prostrate and it feels like it's rigid, don't force it. You don't want to make a false track, but you also want to give it time just to see with a little bit of firm pressure if it will go in. And then that's the end of it. And then I just wipe off my patient and secure the Foley, and it's done. And you'll find your patients are much more comfortable. They don't have, like I said, the bladder spasms or urethral spasms, and they'll appreciate it later. And with the female, it's no different. A lot of times you'll find females don't need it because their tract is so much shorter, but there is no difference with putting the Eurojet in the female as compared to the male. And that's the end of the Eurojet.